The province of Nova Scotia is taking a step, I believe the first one in all of Canada, to begin to pay for mental health counseling services as part of the healthcare service. Now, they are apparently looking for a billing administrator, according to the initial press release and conversation with the minister. But I spoke with the premier this week, and I asked him, why would they look for a separate and standalone billing administrator when we have an administrator, a complete administration that determines what gets covered in the hospital system and in the physical healthcare system? I asked him, why don't we just add these services to the MSI menu? And MSI being Medical Services Incorporated. And he said, well, that's an option. We're just exploring at this point. The bottom line is, when I go to get my broken arm fixed, I don't bother to pull out my checkbook or my credit card. I just tell them my health number and it's covered. When I went to see you or another counselor up until now, I would have to pull out my checkbook or my credit card because your services weren't paid for. Now they're going to be, and Nova Scotia is leading the country. What do you think of that?
I think it's wonderful.
Because you get paid or because we get covered?
Because you get covered. The public gets covered. This is something that has been a screaming need for a long, long time because people have not been able to afford the services of psychotherapists or anybody that would be able to provide them with help with some of their issues. And the waiting periods for mental health have been not in months but years. When I was working in Amherst, we were getting referrals from mental health because they couldn't get to people soon enough, and people were really in trouble, like they were having a lot of difficulty. So this is an enormous boon for the public. I don't know how they're going to work it administratively, but that kind of hardly matters. The fact is that people who cannot afford to pay for psychotherapy or any kind of therapy can now get help. And given what I saw when I was working on contract in Amherst, I can tell you there are a lot of people who really, really could use some help. I certainly have some questions about it. I don't know, for instance, how many sessions they're going to pay for. I don't know what their fee limit is going to be, because at this point, psychotherapists are charging anywhere from 160 to, I don't know, 180, 190 bucks an hour. So, Nova Scotia Health will obviously make some decisions about what they feel is warranted or possible to help people. Yeah, I think it's wonderful.
Yeah, I knew you'd say that, and I was teasing when I said, do you think it's wonderful because you get paid or because we get covered? And I knew you'd say that about being covered. Well, because you and I have talked already, and I know that mental health services and concerns are huge and lead to all kinds of societal difficulties, all kinds of family difficulties, and certainly not the least, all kinds of personal difficulties. And if the bottom line is I can't get help because I can't afford to pay for it, then I become a burden on society in more ways than you can dream. And that's the reality. Now, you just said that I don't know how they're going to administer it and so on. I don't think they know yet either. But the fact of the matter is they know it needs to be done and they're going to do it. And that's been kind of the hallmark of this premier and this government is if we identify a problem, well, then we just want to go fix it. And let's go fix it and worry about the details later kind of thing. Now, not to the point of abandonment, but for example, the minister who's given a specific portfolio. He's the Minister of Mental Health and Addictions Care. That's his departmental responsibility. It's even been separated from the rest of healthcare, not because it's different, but because it's critically important. And the minister, Brian Comer, is a psychiatric nurse. He was a practicing nurse in the psychiatric system. He was the one that identified the concerns and the issues in the real world. And when he got into politics, he started talking to Premier Tim Houston. He was on the Tim Houston team. Started talking, and it was before Houston became premier, I might add. Started talking to him about this need and how important it was. Lo and behold, they became the government. Lo and behold, the premier agreed and then created this separate department, put Comer in charge, and Comer comes out with his first order of business to say, this is what we need to do. So their commitment is real. I think, as you pointed out, there's going to be some wrinkles and twists. When I mentioned half jokingly, if I break my arm, I go to the hospital and I don't worry about paying for it. But I can go and get it done. I just know it's taken care of. I could also stay home and live with the broken arm and then end up with a limb that wouldn't be quite functional. The same thing is true when I've got a broken brain, when I've got a broken mind. I can live with it, I guess, but it's not really functional. Given this, I can go and get it fixed. Now, you mentioned about paying hourly for psychotherapy and for counseling. The way the menu works for other health issues is they identify the necessary way of fixing things, and they give it a billing number. And when I go for my broken arm, they write down the billing number for broken arm, and the doctor gets paid. Simple as that, whatever the doctor's charging. They fix a fee, kind of a minimum fee for each service that's provided, and so on. So you're right. We don't know how it's going to work, but the bottom line is they're going to pay for it. You've identified a concern that I didn't think of and therefore did not ask of the minister, and that is how many sessions. I would go for one session for the broken arm, maybe a follow-up to take off the cast, and that's a different billing number. Maybe a follow-up to see if it's healing okay. That's a different billing number. So what you're identifying is you could talk to me for 2 or 3 or 12 sessions, and I might need 10 more. But
absolutely,
yeah, and that's, you're right. That becomes a problem. There's no easy fix. There's no standard fix, is there, when we come to you?
Well, no. I mean, I probably work differently from a lot of people in this field because I have a tendency to work with people long term. And this means that I can have people for 2, 3, 5, 10 years coming weekly. And certainly the government's not going to pay for that. But they will pay for something to get started. And this... Yeah, I really don't know exactly how this is going to work, but I think it will give some people at least some relief, some hope, some start. I think much more needs to be done. One of the things that we're looking at, or I'm looking at up here in Oxford, is starting groups because there are so many people in need that one person can't handle it all. So there are many different ways to tackle this, but I think that this is an awfully good sign that the government at least is considering. They understand that there is a real problem and that something more needs to be done. And this almost didn't get through because actually it was a conversation that Houston had with I think a woman from Unifor, who was telling him how important this was. And it actually, because he didn't think it was worth doing, and she turned him around. So one of the things that this points up to me is that politicians do listen, and they do take note of things. Getting an opportunity to make a compelling argument can be not the easiest thing in the world, but they listen. So,
are you serious? Politicians listen? I'm kidding.
Yeah,
I'm kidding.
I know. You think they don't, but they take note. And so this was wonderful. Now there are other things that put pressure on this. The mass casualty in Portapic a few years ago has stirred up a lot of concern. And so there were a lot of recommendations around involvement, community involvement, mental health services, all sorts of things to address this, because that was very, very alarming, quite scary. And so this is like the government is responding to the fact that we do have a crisis. And don't forget, Houston announced that intimate partner violence is an epidemic here, and the statistics back that up. So so now he's addressing it, and I'm very glad he is.
I noted there, you said sometimes people listen and they note, and I noted that you talked about perhaps having patients come to you for weekly visits for as much as 10 years, and I kind of gasped when you said that. And I think we need to break down a little bit here. When you talk about the Mass Casualty Commission, and it certainly identified humongous big issues, and we know, of course, the killing spree that man went on. We know, of course, about the intimate partner violence that existed for years. We've heard now that that's a plague on society, quite frankly, now. We've heard also about killing as a result of PTSD, the soldiers returning from battle zones and war zones and so on, bringing with them the weight and the baggage of PTSD. And we see this we talked about before would be kind of the top or the pinnacle of the mental health urgency that's out there. But there are all kinds of others that kind of build up over time. And when you talk about your practice and talking to people for years, you're talking about the legacy of trauma. And we talked about that before. And trauma, of course, you have a car crash and have a traumatic head injury, for example. We're talking about the most serious of serious. And when it comes to mental health issues, the traumatic or the legacy of trauma is the most serious of serious. And that's why it would take you perhaps years to work through the issue with some clients versus others. But but that's not always trauma. The difference between trauma and other difficulties is not that trauma is more serious. It's more that it is serious in a very different way. But it is very serious, though, is the point.
It is very serious, and it robs people of their lives. There's no question about that. I hesitate to try and grade things, because people have a tendency to say this is the worst thing that can happen. Well, that's not always the case, but that doesn't take away from the fact that it is really bad. There's no way of saying that one thing is worse than another. However, because I've worked with non-traumatized people for 10 and 12 years, so this is not just about trauma, although that is one of the biggest things that does need to be dealt with, certainly in this province and definitely in this area. That was something I saw a shockingly high percentage of.
Yeah, and I was not trying to put them into kind of priority 1, 2, 3, but rather simply to say there are some counseling efforts that are successful in short matter, in short time, because the issues the individuals might be facing are not as severe. And so I didn't want to give the impression that all counseling can take 10 years, and depending on the issues. We know, of course, of physical health conditions that are lifetime threatening. They last forever. And people have to deal with it. I used the broken arm, but there's all kinds of other illnesses out there that never go away, that people have to learn how to live with them, the physical restrictions and the physical limitations and arguably the pain and so on an ongoing basis. So on the physical side, 10 years is easily achieved. A lifetime could be the term. So it's not different when it comes to the brain or the mind needing help as well. I just wanted to make that point. It comes in all those flavors and all those sizes. Now, you mentioned a moment ago too about having group sessions and group meetings. You've already done that a couple of times, I know of, at least in the Oxford area. In fact, you have one coming up soon, and you have been very, very kind to offer the same group meeting in Pugwash coming up in March, and we're going to do that right here at Hope Center. The one coming up soon in Oxford, you want to give us a kind of thumbnail description of what that's about and when and where you're going to be?
It's an information session on trauma, and it basically explains the neurology of trauma, why it is different from other things, how it can be tackled on a psychological basis, the fact that it can also be tackled on with other methods. So I go through, it takes about, somewhere between an hour and a half, because people ask questions. But we're doing this on Wednesday, the 19th, at 6 in the evening at the Seniors Club in Oxford, which is at 31 Ellis Street in Oxford. It is not a group therapy session or anything of that sort. It is just an information session to help people understand trauma. Because a lot of people who are trauma survivors, they have a tendency to think they're broken or crazy or something like that, and really they're reacting normally to a perceived danger, because the situation mimics a situation of real danger that they survived. So they need to understand things like that. Triggering what goes on, what the symptoms mean, how to see them as being something that they can use, and people who are close to friends or relatives of someone who is a trauma survivor need to understand something about what drives the behavior of the person. Now, it's not that it makes everything all okay, but understanding and knowing something about the whole situation can be helpful in relieving the trauma survivor of some of their concerns about, what they are, and it can help the people around them, particularly people close to them, like spouses or siblings, that kind of thing. It can help them to understand that this is the behavior of the trauma survivor is not necessarily intentional and deliberate. It's a response to something. So, these are just information sessions.
And at no charge, you might add, too. And I just want to add something there. I know that it might make you feel a little awkward, but you don't need to be. And I want to say this to all the people that are hearing this, and all that who may need to hear more from you, and all those who might want to be considering going to that event in Oxford or the one later in March in Pugwash, is that you are so easy to talk with. You are
Thank
not,
you.
well, you are. You just put people at ease, and you take a very difficult subject and you make it easier to understand, and we go from there. So I thank you very much for what you're going to do within the community. But I thank you, too, for becoming our, well, I keep calling you our resident psychotherapist because we get to talk to you every second week. Thank you for that. Tell people, or I'll tell people, that they can also go to our website, hopecenter.ca. Right there on the homepage, you'll see the Hope Center agenda and the legacy of trauma taking place. The event in Oxford is already listed, and the one in Pugwash will follow. You just go to our homepage. You can see what's happening here and what's happening in the community.